Good afternoon, Miss TF. How are you doing?
I'm doing well. How are you?
Good. Can you verify your date of birth for me?
3188.
Wonderful. As you know, my name's Michael. I'm a family nurse practitioner student at United States University. I'll be conducting a cardiovascular examination on you today. Do I have your permission to record this and share this with faculty, staff, and possibly other students?
Yes.
Absolutely wonderful. Okay, so the first thing that we would do is we would have you, we would take your blood pressure, both sides in both a sitting and a lying position, and then we would compare those two. But for now, I'm going to have you go ahead and lay back for me. First thing I'm going to do is we're going to take a look at jugular vein distension. Ideally, we would have her at a 30 to 45 degree angle. However, I don't have the things to do that, so we'll verbalize that. So what I'm going to do here is I'm going to have you turn and look that way for me. I'm just observing the throat here, and I'm looking for a pulsating mass. Now I do see that, so I'm just going to go ahead and put my finger on it and make sure that I don't feel a pulse. If I feel a pulse, then I know that's the carotid and I'm in the wrong spot. But I don't feel a pulse there, so what I'm going to do is I'm going to take my straight edge and I'm going to find that pulse, that pulsating area. Put my straight edge out there. I'm going to palpate for that sternal notch. Drop my ruler onto that sternal notch and where I measure that at. And that's coming across at less than 3 centimeters, so that's an expected finding. You can go ahead and turn your head straight for me. I'm going to go ahead and check her carotid pulses now, one at a time. And that's a 2+, that's an expected finding. Okay, we do that one at a time so that we don't cut off circulation to your brain and make you go night-night, okay? I don't have my belt and diaphragm stethoscope with me today. I have my Lippmann Cardiologist 2, which is a tunable stethoscope, so no touching the bell gives me a regular diaphragm, and then the depth at which I put my finger onto the bell gives me the lower density sounds, is what one would find with the bell. So I'm going to go ahead and take a listen to your carotid arteries right now. Okay. And I am using pressure on this to use it as a bell. And I don't hear any bruise or anything like that. Next, I want to move down to the chest, looking at symmetry, looking at the sternum for any deformities. Also want to observe for any pulsating in the hilar region. Also want to look for that point of maximum impulse, typically 5th intercostal space, mid-clavicular line. If I were not able to see that, I'd ask you just to slightly roll over to your left side for me for just a little bit. About right there is fine, and we can observe for that. Okay, you go ahead and lay back flat for me. Also going to palpate along the areas that we would be listening for. We're going to be palpating for any heaves or thrills. So basically I'm just going to put my hands here, and I don't feel anything there. So we're going to go ahead and take a listen. I'm going to listen first with the diaphragm side, and then I'll use my finger to tune it into a bell. So we're going to be listening to the 5 points of the heart. So the ditty that I like to remember this with is all patients enjoy taking meds. Okay, so first thing we're going to go for that 2nd intercostal space just to the right of the sternal border, and this is the aortic valve. So diaphragm, and again with bell. Now we're going to move over to the pulmonic, which again is the 2nd intercostal space, but it's on the left sternal border. Diaphragm, bell. Okay, moving down to about the 4th intercostal space, 3rd to 4th intercostal space, left sternal border. This is Erb's point, diaphragm, bell. Gonna move down to the 5th intercostal space, on the sternal border, left sternal border, and this is the tricuspid. And again, diaphragm, bell. And finally going to move over to that fifth intercostal space, mid-clavicular line. And this is the mitral valve. Again, diaphragm and bell. Okay. I'm going to go ahead and move on and assess the peripheral cardiovascular system. So we're going to check a couple different pulses here. We're going to feel that brachial pulse. And we can feel these both at the same time and comparing sides. And they both feel equal. We're going to move over to that radial pulse. And those are both equal and present. Okay. I'll have you bend your knee up for me. Bend both up. And we're just going to get back behind there. I'm sorry if this is ticklish, but we're going to find that popliteal pulse, which lies right back in that popliteal fossa. And there it is. And again, we'll come over to this side. Okay. And as we're going down here, I am assessing for any edema. If I did see any edema on there, on her lower legs, I would press that and gauge its pitting. I'm not going to have you take your socks and shoes off here, but moving down, right back behind the medial malleolus is the posterior tibial pulse. And then up here in between this first and second metatarsals is where we would find the dorsal pedalis pulse. And again, we compare and check both sides. Also, a good assessment for cardiovascular, or just make sure that general blood supply is getting down there, is any pedal hair growth. So we look to see if we got any hair on your toes. Also, check capillary refill on the nail beds 1 through 10 down here. We should expect to see that under 3 seconds. I'm going to listen to a couple more things here on your tummy. We're going to go ahead and palpate, see if we can't find that aorta. And there it is. I'm going to go ahead and take a listen to that. Again, we're going to do diaphragm and bell. And I am oscillating for any bruise, of which I hear none. I'm going to go ahead and move down to the iliac arteries. Again, diaphragm and bell. Diaphragm and bell. And then I move down to the femoral arteries as well. Okay, she has nail polish on, so I can't check capillary refill on these nails, but we can look for nail clubbing. You can go ahead and sit up for me. What I'd like you to do, put your thumbs together like that for me, just like this.
Ow.
Okay, so what I'm assessing is something called Lebovand's angle. If she were to have nail clubbing, I would not be able to see that nice little space of light in between there. In addition to nail clubbing, we'd also be looking for any splinter hemorrhages, Bowes lines, things of that nature. Anyway, that concludes our cardiovascular examination.
Well, thank you.
Thank you. Nice to see you again.